My name's Neil, I'm a pharmacist at the Royal Cornwall Hospital, and I'd like to welcome you all to this event. It's a One Health Antimicrobial Resistance conference, and thank you all for coming, and thank you all for being part of this and making it the enjoyable experience that I hope it will be. And I really want to thank Louise and Louisa and Lee, who've organised this with me, and without them, this wouldn't be possible. And these things are quite stressful to organise and take a lot of time, and they've made it quite enjoyable. So thank you very much for your help. So this has been Royal College of Surgeons and Royal College of Physicians CPD credited. So if you are belong to any of those sort of organisations, this has got 5 CPD points accredited. And also want to thank our sponsors as well for sort of enabling this event to happen, because without them we wouldn't be able to do this. So these are our sponsors. So Radiometer at the back, so they've got a point of care procalcitonin test. Alea have not arrived, so I won't tell you what they've got. Pfizer, Cardiome, MSD, and Nanoportec are all here. So we've got some diagnostics companies, and we've got some big pharma companies as well, and little pharma company as well. So please go and visit those stalls, because without them, we wouldn't, as I said, wouldn't be able to do this. Nanoportec have got a whole genome sequencing kit that they want to give away. So go and visit them and sort of enter their competition. So if any of you are tweeters, we have got a hashtag EdenAMR, so please do tweet as we go through. Relying on you, Philip, for that. And this is being filmed as well, and will go on the Royal Cornwall Hospital YouTube channel. Andrew Sims, our cameraman at the back, he's not just any sort of old cameraman. He is the cameraman from Devon and Cornwall Cops, and there's other sort of claim to fame as police interceptors. So we've got a good cameraman for you guys to capture this conference. So please do go back and visit these sessions on the YouTube channel. So a bit of housekeeping. So acronyms are a real sort of pain for people and sort of make it difficult for people to understand. So this is a plea to the speakers, really, when you're using acronyms, to please sort of explain what those acronyms mean. And also to the audience, when the speakers do explain what those acronyms mean, just write them down quickly, because they will then revert back to acronyms, I'm pretty sure. So if you make a note of that, it might make it a bit easier to follow. I've not been made aware of any fire drills that are planned. So if the fire alarm does go off, then we need to sort of walk out of here and sort of congregate by the bus drop-off bit, sort of past the entrance there. And the toilets are just across the walkway here. We've got 2 scheduled breaks. So we've got, after me, we've got Matt Averson talking, and then we've got a tea and coffee break. So tea and coffees will be on the sides over there. And then we've got lunch at 12:45 to 1:45. Now, unfortunately, we don't have access to the biomes, so lunch will be sort of in the canteen next door. And as you're aware, this is a non-catered event just because of the sort of costs that would have involved. And we wanted to keep this a free-to-attend event. So to keep it a free-to-attend event, we had to sort of make that difficult decision about lunch. So it is a sort of buy your own or bring your own. If you haven't brought your own and you haven't brought your wallet, can you come and find me, and we'll sort of work out what to do with you, because we don't want you starving, sort of thing. But yeah, come and find me. And please do visit the sponsors' stands as well, because we want to sort of, we want these guys to sort of sponsor us in years to come, and without you guys sort of interacting with them, they might feel less inclined to do that. Evaluation forms, so you've all been given evaluation forms, so please fill those in. Really sort of need to know what worked well, what didn't work well. We do want to keep doing this every year. We want to make it sort of better each year, so we need those forms, so please fill those in. And if you're not aware of the Antibiotic Guardian campaign, and I'm sure other speakers will mention it, it's a sort of public awareness raising sort of campaign run by Public Health England. And it's an opportunity for people, healthcare professionals and members of the public to make an antibiotic pledge, to sort of pledge to be an antibiotic guardian to protect this sort of finite resource. So please, if you haven't become an antibiotic guardian, please do log on and do that. So I just sort of introduced this event. So this sort of all started out really for me and my sort of interest in this area around about this sort of time. The UK 5-year resistance strategy was published in 2013, and this was a Department of Health and a DEFRA sort of joint publication. And within this, it laid out the key aims that were needed to be met to sort of try and control the sort of antimicrobial resistance problem. And within that, the seven key sort of aims are to improve infection prevention control practices in human and animal health. So it's really sort of saying, look, we're doing a lot of work in the human arena, or we need to. We also need to do a lot of work in the animal arena as well. So that sort of brought those two together. It recommended implementing antibiotic stewardship programs. So in hospitals, there are sort of well-embedded antibiotic stewardship programs now, and in primary care. And there's a lot of work going on in the animal world as well, looking at sort of antibiotic stewardship in sort of large animals and small animals. So we need to improve what we're doing there. Improve professional education, training, and public engagement. So the public engagement, so the Antibiotic Guardian sort of talks to that public engagement. Improving professional education, so this sort of talks to that as well. So this is part of the sort of 5-year strategies to hold these sorts of events and sort of improve or increase further sort of understanding around sort of One Health antimicrobial resistance issue. Develop new drugs and treatments and new diagnostics. So we've got sort of companies that are developing new drugs and companies that are developing new diagnostics. And you'll hear about new treatments this afternoon with Lloyd, who'll be talking about bacteriophages and lysins. And I hope he talks about ninja polymers as well. So we'll hear a bit more about that. And then we need better access to and use of surveillance data in humans and the animal sector. So we've got some very good now sort of data through Public Health England's second-generation surveillance system, so we know what our antibiotic resistance rates are like in the human world. Got a bit of animal data. We've also got good sort of antibiotic usage data, and that's getting better. It needs to improve, so we know how we're doing with usage and resistance. And then we need to identify research needs to focus our activity. We've got Anne here who will be talking about, she's an academic, we'll be talking about some of her research around sort of antimicrobial resistance. And then we need to strengthen international collaboration and work between countries. So Dame Sally Davis, who's our Chief Medical Officer, she's working now for the UN to sort of lead this work globally. And again, I've seen the speaker's slides, so I know they're going to talk a bit about this as well, but this was published last year. So David Cameron commissioned this report a few years ago, and it was led by a macroeconomist called Jim O'Neill, looking at the sort of antimicrobial resistance problem and how to tackle it, and put some costings to it and some big numbers to it to try and sort of engage governments and people in sort of problem. And this was a final report of about 8, I think, and these were some of the things that came out of that. So it says in that report, if antimicrobial resistance is not tackled, just left as is to sort of play out, then we'll see someone dying from an antimicrobial resistance every 3 seconds by 2050. And there's also sort of projected that currently we see about 700,000 deaths due to antimicrobial resistant infections, but by 2050 we expect to see about 10 million deaths due to antimicrobial resistance infections, which is more than the number of deaths we see currently for cancer. And they also sort of put the global cost of antimicrobial resistance in dollars. So the lost productivity through morbidity and mortality through these infections sort of projected to cost the global economy $100 trillion, or 66 trillion pounds, although with the exchange rate probably a bit different to that, but that's what it was at the time. And this is what they said. This is what the summary of those documents were about how do we tackle this problem. So raising public awareness is one of the top priorities, improving sanitation, so clean water, hand hygiene, looking at antibiotic use in agriculture, particularly sort of growth promoters, and then looking at the impacts of sort of effluents from animals and humans and what impact that has in the environment, and what the environmental sort of contamination, what impact that has on us, and Anne will be talking about that, and Matt will also be talking about that as well. Adopt sort of new vaccines, or adopt novel vaccines, use vaccines that are available and try and develop new ones. And also look at alternatives to antibiotics, so sort of bacteriophages and probiotics and things like that. Better surveillance of antibiotic use and antibiotic resistance. This is a sort of global strategy. More rapid diagnostics. If we have more rapid diagnostics, that will transform the sort of way we manage antibiotics and will enable us to use more targeted therapies and withhold antibiotics when we sort of quickly disprove that, the patients do not have a bacterial infection. The human capital one is interesting. I think it's a good time to sort of be involved in antimicrobial resistance. They suggest more funding for more people, higher pay to attract more talent. So it's really suggesting sort of investing in human capitals for people to work in this arena. Develop new drugs, we've mentioned. And then global innovation funds sort of set up sort of billions of pounds or dollars of pots of money for people to tap into to develop new diagnostics and novel sort of therapies, novel strategies. And then again, international collaboration, which our sort of country is very much sort of leading on. So that's the strategy. Sounds easy. So this conference really picks up on quite a few of these bits and sort of gives you a bit more information about them. So that's all from me. First up, we've got Matt Avison, who will be talking about antimicrobial resistance in agriculture. So Matt works at the British Veterinary School and the School of Cellular and Molecular Medicine, and leads the University of Bristol's One Health selection and transmission of antimicrobial resistance project, the OSTAR project. So Matt will be up in a minute. Then we've got coffee, tea. Then we've got Anne. I'll introduce Anne before you come up. And then we've got Enrique. I'll introduce Enrique before you come up. And then lunch, 12:45 to 1:45, and that will be next door in the canteen. So I'd like to introduce you to Matt.